In this video, we will discuss about osteosarcoma. Osteo means bone, sarcoma means neoplasm. Highly malignant neoplasm of bone. It is most common primary bone disease. So, malignant tumor of bone. Next, etiology. Primary neoplastic or tumor cell are going to producing the bone. So there is going to be excessive bone disease, may be produced osteoid, may be production of immature bone cell within the tumor. We will see the osteoid cell or immature bone cell presented in tumor. Next, how does the tumor rise? Either it can be trauma or it can be radiotherapy to the pre-existing bone disease. Trauma or radiotherapy because of pre-existing bone disease. Can be any type of bone disease. Chronic osteomyelitis or fibrous dysplasia or joint cell tumor of bone, osteosarcoma or osteogenesis imperfecta. It can be any of the pre-existing bone disease which can later on to produce osteosarcoma or from malignant tumor. So these are the different kind of bone diseases later form malignant tumor. So the clinical features, it is distribution seen in 2 decades. First one is 10 to 20 years. Another one is more than 50 years. Most commonly seen in males and seen in most common in long bone. But this osteosarcoma are almost seen in maxilla, and comparing to mandible, it is found in maxilla in high amount. Osteosarcoma. There is fast enlarging painful swelling which will cause expansion and distortion of cortical plates. So every time if there is painful swelling, fast enlargement, confirm it will causes expansion and distortion of cortical plate. So there is facial deformities. So it causes facial deformities. There is very severe functional deformities. So very difficult to taking food. So it will causes facial deformity. So very difficult to taking food. Next, discuss about mandible. There is going to be paresthesia or numbness of lower lips and chin. Paresthesia or numbness of lower lips and chin. This is most commonly involved in inferior alveolar nerves. Next, maxilla. We see the paresthesia of that infraorbital nerves and which will cause by the epistaxis, nasal obstruction. There can be loosening of teeth and can be increasing pressure in the eyes. In this maxilla, we can see this one in infraorbital nerves. It causes epistaxis, nasal obstruction and loosening of teeth and can be increases pressure of the eyes. Osteosarcoma, next one is overlying skin of that osteosarcoma, overlying skin of osteosarcoma lesion will be red, inflamed, ulcerated. Hemorrhage can be seen in this region. So, in osteosarcoma in skin, it causes red, inflamed, ulcerated, or hemorrhage can be seen in that particular region, especially in skin. If we look at radiography, it, it is very important. If we look at X-ray of osteosarcoma, we have two type of X-rays, osteolytic type and osteoplastic type. We will discuss one by one. First one is osteolytic type. This osteolytic type means the osteosarcoma will destruct bone. If lesion is presented, it will destruct the normal bone. In that particular case, the lesion going to be large. The appearance of osteosarcoma, we have moth-eaten appearance. What is moth-eaten appearance? A large radiolucent. We have ill-defined border, and that ill-defined border, because it has osteolytic cell, it eat the border that appear moth-eaten appearance. This one is the normal teeth. This border will defected, so it causes moth-eaten appearance. After that, osteolytic type, normal teeth like this means osteolytic bone like this appearance is presented. So there is root resorptions of teeth. It is called as spingy resorptions. Second type is osteoplastic type. Here a newly formed bone in the tumor. Within the tumor there is radio opacity is present. The appearance is X-ray or sunburst appearance. So it is called as Cartman triangle. Here tumor formation in bone. Final one is treatment of osteosarcoma. In the case of long bone means we will do amputation. What is amputation? Suppose this one is the bone, here affected means that affected area we can cut and remove. So long bone means amputation. Other side, other than bone, other side means we will do radical resection. What is radical resection means? This one bone affected, other area affected means that complete area we can remove. Next one is we will give treatment purpose neoadjuvant chemotherapy. This one we will give before surgery, because it will give before. Why means this one will shrink the tumor, so it is easy for surgery. After surgery we will give adjuvant chemotherapy. So long bone means amputation, we will cut that part. Other side means we will remove that part. Neoadjuvant before surgery, adjuvant chemotherapy after surgery. So this is all about osteosarcoma. This one is the statement format. Thanks for watching.